What distinguishes MS-related optic neuritis from MOGAD? Imagine a sudden change in your vision that feels alarming. Both multiple sclerosis-related optic neuritis and myelin oligodendrocyte glycoprotein antibody disease-related optic neuritis can cause sudden vision loss, but they have key differences that help doctors tell them apart. In multiple sclerosis-related optic neuritis, the problem usually affects just one and involves a short segment of the optic nerve. Patients often notice pain with eye movement and see a sudden decrease in vision in one eye. Recovery tends to be better in MS, with many patients regaining much of their vision over time. The damage in the eye is often localized, especially in the part of the retina called the temporal quadrant, which shows thinning on special imaging tests. In contrast, optic neuritis caused by myelin oligodendrocyte glycoprotein antibodies tends to affect both eyes more often and involves longer segments of the optic nerve. Patients may experience more severe symptoms initially, including significant vision loss and swelling of the optic nerve, known as papilledema. On imaging, the optic nerve often appears swollen and inflamed across its length, with enhancement seen on magnetic resonance imaging scans. This type of optic neuritis is driven by antibodies attacking a specific protein called MOGAD, leading to more widespread nerve inflammation. When doctors look at the eye with special tests called optical coherence tomography, or OCTOBR, they see different patterns. In multiple sclerosis, the thinning of the nerve fibers is usually limited to the back part of the eye, especially on the side closer to the temple. But in MOGAD antibody disease, the thinning is more diffuse, affecting all parts of the nerve fiber layer. The underlying causes also differ. Multiple sclerosis involves immune cells called CD8+ T cells attacking the nerve, mainly targeting short segments and specific types of nerve fibers. MOGAD antibody disease involves antibodies in the blood that attack the MOGAD protein, causing widespread inflammation and swelling of the nerve. Blood tests help distinguish them further. People with MOGAD will have MOGAD IgG antibodies in their blood, which are not present in multiple sclerosis. Meanwhile, MS does not have these antibodies but may show characteristic brain lesions on MRI, like the central vein sign, and sometimes spinal cord involvement. Understanding these differences is crucial because they influence treatment choices and prognosis. While both conditions can cause vision problems, their underlying mechanisms and patterns of nerve involvement are distinct. If you experience sudden vision changes, it is essential to see a healthcare professional promptly for accurate diagnosis and personalized care. Always remember, each person's experience can vary, and medical advice tailored to your specific situation is vital.